Well, our next story shows us one solution that seems to be working for those who have lost insurance due to retirement, job loss, or because, like many employers, they're cutting that program out. It is called VitaHealth, and for the man you're about to meet, it was literally a lifeline. Robert Wallens was in trouble with his health and his health care.
I said to the cashier, I have no money. And that's exactly what I said. I figured, let me start from that perspective. And she said, what's your income? And I said, what income? And she looked at me, and it turned out that there was this thing called VitaHealth.
VitaHealth are premiums that need to be paid on a monthly basis, starting as low as $25 a month. And then we pay the 2/3 shared cost of the premium for the member.
Customer service, Esther speaking. How may I help you?
The low-cost insurance program is funded through the Palm Beach County Healthcare District and covers primary doctors, outpatient, and hospital visits. That fact has helped Robert breathe a bit easier.
I was actually afraid to go for regular checkups and so forth.
Ronnie is the Director of Eligibility for all coordinated care plans. That includes the one helping Robert. She says the uninsured crisis is not just affecting the poorest communities in Palm Beach County.
It's hitting a different population now. Many of our clients never had to apply for any programs before in their life, and they're unemployed, they're losing their home, they're going through foreclosure, and they have sickness and they need coverage. They have no other, choice.
At the Coordinated Care Call Center, residents can be directed to the plan that is right for them. From options that offer free care to the VitaHealth program, which is available to nearly everyone.
That's the only drawback. If you're eligible for Medicaid, Medicare, veterans benefits, Florida Healthy Kids, then you will not qualify for our program.
The numbers applying for county programs have increased 25% in the past 6 months. And Ronnie doesn't see that going down anytime soon.
Well, the numbers are alarming. You see it in Boca, in Delray, West Palm. It's all over across the board. It's affecting everyone. Now it's affecting the middle class, which we hadn't seen before.
Welcome our next guest, Robin Kish, Administrator of Public Affairs for the Palm Beach County Healthcare District, and Marge Sullivan, the Vice President of the Palm Healthcare Foundation. Welcome to both of you. And VitaHealth is one of the many coordinated care programs run by the Healthcare District. Why the need for a program that really is aimed at people who have, a fairly decent income?
Well, the Healthcare District knows and recognizes that the number of uninsured has grown, continues to grow, especially with the economic downturn that we've seen. There was a study, the Florida Healthcare Study in 2004, that showed anywhere between 185,000 to 250,000 residents in the state, or in Palm Beach County rather, are uninsured. And we noticed that a growing number, an area that was growing the most, were those who were 300% of poverty, which is, for an individual earning, $31,000 a year, or a family of four earning $63,600 a year. And that was the area that we wanted to focus on, to offer affordable health coverage that the Healthcare District could then share the cost of. Premiums are as low as $25, and the range of services, hospitalization, benefits like primary care and specialty care, doctors, prescription drugs, mammograms, tests that need to be done. These were important to people. We found that this was of value and that this was really going to resonate, and we've seen the numbers grow.
And the numbers are growing, and I know, Marge, at your foundation, like in the Quantum Foundation, you really focus on health care. You have a children's medical services, you have a whole new healthcare pavilion. Is it the same for you, that you just feel this need growing and growing, not only for insurance, but for just health care in general?
Right, absolutely. And that's why when the other two speakers were talking about public-private partnerships, that's what we're really looking at in the community, trying to help others by coming together. And Children's Medical Services is the Palm Healthcare Pavilion, and Children's Medical Services is really our largest and most important endeavors to date. And we're really coming together to try to provide services to people who are falling through the cracks whether they're citizens, whether they're not citizens, whether they have insurance or they don't. The need is greater, and we're definitely there trying to find some solutions, working together with other community members to find solutions.
And it was interesting because Robin had actually introduced us to Robert, who was featured in the story, and I had an image that, you know, a lot of the people without health care may have been of a certain ethnicity, migrant workers, farm workers who worked the fields. Yet Robert worked his whole life, and he told me he's met a lot of other people in his position where they had no idea there would be that gap. And here they are, one doctor visit, $2,000, one doctor visit. And it's amazing to me that in this day and age, you are having to provide this kind of health care and you're having to kind of fund these kind of programs, yet it's a real need.
Well, Tony, another trend is that people who are offering insurance to their employees, they're now changing the kind of plans that they offer, and so more of the burden is shifted to the employee to pick up the costs, and so that's why some of the programs we have, like the Diabetes Center at Palm Healthcare Pavilion, allows people to come even if they don't have insurance or even if their insurance does not cover the sorts of education and management of diabetes that they require.
And Robin, we had talked with Ronnie in the piece about the needs, the numbers growing. Is the healthcare district ready, like I was asking Dr. Alonso, for those needs that 75% higher in the last 6 months? Are you ready to get these people some coverage?
The healthcare district has really taken a planned approach. The uninsured issue was an issue that the healthcare district addressed long before it was in the headlines. And I think that's why we've been prepared, because we want to get the word out. We want to let people know that we have customer service representatives standing by who speak Creole and Spanish and English and can answer questions about all of our programs. Coordinated Care, which began 14 years ago. Vita Health, which is our newest program, which will expand eligibility in October so more residents will be able to participate. Our maternity care program, which has been in existence since 2004, we recognize the need for those expectant moms who didn't have insurance, that they could also get the prenatal care that they needed, that their baby needed to stay healthy. All of these programs are available, and we really want to make sure that residents know that they are available. Some people don't have health care coverage when they work, their employers don't offer it. A lot of single parents could use this. So many people from all different walks of life we're seeing. And the phone number, if I could give it, is 1-866-930-0035.
And we will put, we have the information for the different programs that we were introduced to. We will put all that on WXEL.org because I know it's a lot of information coming to you. I want to wrap it up, but I want to say this. Prevention, as Paul said, is the key. A lot of the programs, both of you, and I know at CMS even, is preventative. Do you see those programs, Marge, the funding for those programs growing? Because they have to.
Well, I see us stepping in and really helping with that, because I think prevention and accountability is key, and we are offering programs where people can learn how to be healthier and how to take care of themselves, so hopefully they won't need as much acute care.
I hope so. I hope we can follow the trend that the rest of the world does. Thank you so much for joining us. Again, the information will be on WXEL.org. Thank you, ladies.
Thank you.
Now, don't forget to join us, as I said at the beginning of the show. The Point of View documentary airs right here, September 30th at 9 p.m. We'd like to thank our local partners in bringing you this special show, the Palm Healthcare Foundation and the Quantum Foundation, without whom we could not have brought this to you, and our national funder, Outreach Extensions. Thank you for joining us again. Log on to WXEL.org for more information about tonight's show. Good night.